Okay, ready? Go. Hey guys, we're Team Angels, and today we'll be discussing how we got involved in the community and our experiences that we had. Imagine feeling alone, no family to talk to, no cell phones to go on, to look at social media, text, and call. According to assistedlivingfacility.org Access on November 11, 2016, 8% of residents living in nursing homes don't receive outside visitors. Up to this point, none of us have done any volunteer work pertaining to the elderly, which made everything a new experience to us. According to this statistic, however, it encouraged us even more to want to get involved and help. 2 Fridays ago, we volunteered at a local elderly facility called Amber Grove Place. Today, I will be discussing the background behind the situation. Alejandra will be discussing the actions that we can take in getting involved. Victoria will then describe what we actually did, and Pamela will conclude this presentation with describing the impact we can have. According to the Centers of Disease Control and Prevention, Access November 8, 2016, as of 2014, there were 15,600 elderly homes housing a total of 1.4 million residents. While at Amber Grove, we helped around 20 residents participate in the planned activities for the day. There are multiple reasons for why people live in nursing homes, and surprisingly, most of them are female who do not have a significant other anymore. But the most common reason for people to be living in these facilities is due to disability with activities of daily life. And in fact, 68% of people 65 years and older will experience this, as stated on caregivers.org Access on November 11, 2016. Other reasons for people to be living here are due to mental problems like dementia and problematic behaviors including verbal and physical abuse, acting inappropriately in public, resisting necessary care, and wandering. When we were volunteering at Amber Grove, some of the residents actually displayed some of these symptoms. One resident in particular had no filter when she was talking and would say whatever was on her mind, and even though some of the comments may have been hurtful. And I gotta give props to the workers for having the thick enough skin to not show a reaction. Other residents continuously asked the same questions over and over again, and it was our job to answer them the best we could. The number of people living in elderly homes is expected to increase in the future, and according to the caregivers.org updated in February 2015, quote, 1 in 4 people aged 45 years and older are not at all prepared financially if they suddenly required long-term care, end quote. The average daily rate for a private room in a skilled nursing facility is $192, summing to a total of $70,080 annually, and $169 or $61,685 annually for a semi-private room. Stated on the livingfacilities.org Access November 11, 2016, quote, studies show that family and friend involvement is important for elderly residents in long-term care. The National Center for Biotechnology Information found the quality of life increases with family involvement, fewer health conditions, participation in social activities, and an environment low in conflict, end quote. It's good to have company of people who love you and support you and assure you that you're not alone. And it just helps with the residents becoming more active. And in the picture displayed on the screen, it shows how most people do receive visitors, except for 8% really don't in a 30-day period. I personally can connect to this, how my grandpa was put into a living facility when he couldn't do all the daily functions such as get dressed, shower, and go use the restroom, and his face would brighten up when we would visit him, and I could see that with a lot of other patients as well. And during the holidays, kids would come in and deliver gifts such as stuffed animals to the residents, which also brightened their days. And in the end, visits from outsiders do really make an impact on the residents' lives. And now I will give the floor to Alejandra to discuss the possible ways we can get involved.
Okay, so when we first started brainstorming on ideas on how to get involved with volunteering with the elderly, we didn't really have too many. The most common and easiest idea we came up with was volunteering at a nursing home. We first found a website of a home here in Chico we needed to sign up for online. So we all started signing up, we even did a little biography section, and when we came to the next part of the website, it asked us for a monthly donation of $10. And all of us being poor college students couldn't honestly afford to pay that monthly fee. So since that place didn't work, we found another home called Amber Grove. Pamela then emailed a worker asking what times are available for volunteers. We also thought about cooking for the elderly, but the problem with that was how we were going to give the food to them. It's not like we can just give food to random people that we see. I doubt anyone would feel comfortable eating something that is given to them by a random person. Another idea was joining the Adopt a Grandparent program. This program is actually a very good program. Some of the things that we would do would be like taking food to them, or to the doctor appointment, or to their doctor appointments, or maybe even bring them food around the holidays. According to the ncbi.gov Access, November 11th, 2016, quote, many people experience loneliness, depression, and depression in old age, either as a result of living alone or due to lack of close family ties and reduced connections with their culture of origin, which results in inability to actively participate in the community activities, end quote. Many people don't take into consideration how lonely old people living in nursing homes actually feel. This is why programs like Adopt a Grandparent are very important. However, the problem with this idea was that we weren't sure how long it would take to actually be paired up with a grandparent, and we were very limited on time and didn't want to risk it. Also, this is more of a long-term volunteer, and all of us being full-time college students, I don't think we would have time for something like this. And lastly, we also came up with the idea of planting little garden pots and possibly going to a home and giving them out, or maybe even to any elders downtown or even here on campus. So that's pretty much it for what we came up with when brainstorming. And now for one of the biggest organizations involved with elderly is the American Association of Retired Persons. In other words, ARP. ARP is a nonprofit organization. According to ARP.org Access, November 11, 2016, their mission statement is ARP enhances the quality of life for all as we age. We champion positive social change and deliver value through advocacy, information, and service. It is available to people, end quote, It is available to people over 50 years old. And what this organization does is basically offer all kinds of help to the elderly. Some of the big things they do are offer them free rides. They also offer discounts on so many things. It could be something as simple as something from the market or something like a flight ticket. They also offer a lot of care for their members. It could be long or short-term care, whichever is needed by them. Another nonprofit organization is a nationwide Alliance for Retired Americans, which is what this organization basically does is work to provide stable living conditions for seniors in need of help. This organization launched May of 2011 with more than 4.3 million workers. According to retiredamericans.org Access, November 13, 2016, their mission statement is, quote, to ensure social and economic justice for full civil rights and all citizens so that they may enjoy lives of dignity, personal and family fulfillment, and security, end quote. Now I will pass it on to Victoria.
People volunteer at elderly homes for all types of reasons. Maybe they have a family member there, or they simply just want to give back. We decided to volunteer with the elderly to give them social interactions with someone besides their caregivers, and to show them that college students care about their elders. We started our process with researching homes that would allow us to come and volunteer with no training or applications. We came across a nursing home named Amber Grove, and on their website they stated that, quote, we are proud of our reputation for being one of the most progressive memory care communities in Northern California, end quote. After finding the Amber Grove place, we called and emailed them, and they told us that they would love for us to come and help. As soon as we got there, we were asked to participate in Sit and Fit. Sit and Fit was an activity where we sat with the residents and stretched and worked out with them. This activity was great because according to seniorhealth.org, quote, studies show that exercise provides many health benefits and that older adults can gain a lot by staying active. Even moderate exercise can improve the health of people who are frail or have diseases that accompany aging, end quote. After Sit and Fit, we were asked to help the staff make the residents stress balls. We made the stress balls with bird seeds and balloons by putting the bird seeds in the balloon and tying it together. As the caregiver explained to the residents what stress was and how it affected them. According to stress.org, quote, chronic stress is widely believed to accelerate aging, end quote. As well as accelerating aging, it also weakens the immune system, making the elderly prone to more diseases. We also had to explain what the stress balls were numerous times and how to use them because the residents seemed to forget easily. Overall, working with the elderly was a very fun and rewarding experience. After discussing our time, we agreed that volunteering gave us a sense of purpose and took the focus away from our own personal concerns. The best part for us was how funny and nice the residents were. The caregivers were also very nice, and you could tell that they really care about the residents. They even told us that there would always be a name tag for us if we wanted to come back. We loved the Amber Grove place and hope to visit sometime soon. And now Pamela is going to assess the impact that we had.
Socializing with the elderly is very important for them. It affects their psychological and physical wellness. It also reduces their stress, and their stress consists of their family not coming to see them or them not knowing what's happening. Also, it helps them defeat depression and anxiety. Exercise is good for them. They try at the Amber Grove once a day to have exercising sessions. It prevents them to have chronic disease, also improves their mood, and it lowers their chances of injury. According to agingcare.com, retrieved on November 10th, many medical conditions are improved with exercise, including Alzheimer's and dementia, heart disease, diabetes, and many more other diseases. About 5% of the 65% of the population consists of people in nursing homes. According to Nursing Home Diaries retrieved on November 9th, it said, quote, about 4.2% of people are in nursing homes, and at any given time, almost 50% of those 95 and older live in nursing homes. This affected our group in many ways. Our group saw the elderly very different, and from this experience, it brought us even more together. And also, it made us want to go volunteer again, and we're trying to go next month. And the conclusion is, if you have anyone in the nursing homes, you should just go and visit them because they probably are depressed or isolated from the world, and they can get very lonely. And if you have the time to go volunteer, you won't regret it. And that is our conclusion.